I wonder if, if it's possible to have an ear infection because they may want to add an antibiotic.
Mina Singh is in her final year at the prestigious Harvard Medical School.
Open your mouth again. I really thought I would go into more of internal medicine. I was really interested in treating the African American population and kind of having an impact in that community.
Her interest in medicine was nurtured by her mother, an internist with a respected practice in Kansas City, Kansas.
And that definitely had a big impact on me growing up because not only did I see her as a very powerful, intelligent, and respected Black female, but also I saw how she cared for her patients and the relationships she had with her patients.
Singh is on the cusp of beginning a medical career potentially filled with long hours, moderate pay, and emergencies in the middle of the night. Like thousands of other smart and accomplished would-be doctors across the country, Singh will soon find out whether she will be accepted into her preferred residency, a multi-year training program after med school. Befitting her Harvard pedigree, Singh is, of course, applying for one of the most competitive residencies. Not neurology or internal medicine, but dermatology, a specialty that focuses on the skin, hair, and nails and has very few emergencies.
It's an understandable perception that, dermatologists only do Botox and they're treating acne and warts. But what people don't know is there are over 300 different diseases that are very debilitating. I realized that skin of color is something that not a lot of people are addressing and not a lot of people are interested in. I knew that was something I wanted to pursue.
The competition is fierce because there are so many talented students applying for very few spots in the small specialized field of dermatology. Last year, aspiring dermatologists had the highest percentage of members in the Medical Honor Society and the second highest median board scores. But saving skin did not always have the same cachet as saving lives. In years past, bright students like Singh would have gone into internal medicine or obstetrics. But today, these programs struggle to attract top students away from lifestyle medicines that offer better pay, autonomy, and more controllable hours for doctors. Medical students call these specialties the road to happiness.
So ROAD is an acronym for radiology, ophthalmology, anesthesia, and dermatology, which are quote-unquote the lifestyle fields. They're definitely more conducive to having a life outside of the hospital, which people should want.
Perhaps Singh represents a new generation of doctors, but some physicians worry about the brain drain from branches of medicine that treat major diseases and cure sick patients to those like dermatology that sometimes cater to healthy, cash-paying clients who want to look better.
I have a lot of acne, more acne scars that I'm concerned about now, so.
Okay.
Yeah,
Are you still getting active breakouts?
Occasionally.
There are still some people that think of dermatologists as just pimple poppers, but it's so much more than that. And I think the public still has a lot to learn about what a dermatologist actually does and the whole gamut of things that we treat.
Dr. Emmy Graber is a dermatology fellow at Skincare Physicians. Cosmetic patients often flock to this thriving dermatology practice in the suburbs of Boston, looking to improve their appearance with Botox and other skincare treatments. But patients also come for skin cancer surgery and treatment of moles and birthmarks with top-notch lasers. The advances in technology, research, and surgical techniques are a large part of what is attracting bright minds like Dr. Eric Parlett to dermatology.
I like the intellectual nature of dermatology. A lot of diseases present with skin findings, whether it's malignancies, autoimmune diseases, or infectious diseases. Plus, there's a lot of surgical aspects. I've always just liked procedures. I've liked working with my hands. So it's kind of a nice tie between medicine and surgery. You're taking out skin cancers, you're doing rejuvenation procedures and laser procedures and liposuctions and things of that nature. So it's attracting a much broader field of people into this specialty.
So if somebody wants to make their mark and they're a young MD, PhD from Harvard, and they think, wow, I can make a real difference in dermatology. It's still a young profession than there has been in some specialties like oncology or cancer or cardiology, where there's been way more specialists in those areas for longer, way more funding for longer.
I think it's always been a field that attracted people who were smart.
That looks very much like a squamous cell carcinoma.
And who had enough ego strength to go into something that only 1% of people do. I mean, only 1% of physicians are dermatologists, roughly.
Dr. Harley Haynes has mentored dermatology students like Mina Singh at Harvard Medical School for more than 30 years.
30 years ago, the perception of dermatology was that it was sort of a peripheral, not very essential subspecialty.
But Dr. Haynes always encouraged his students to choose dermatology for a number of reasons, including the variety of patients, the allure of being one's own boss, and the fact that the skin is something both doctors and patients can see.
And then when it's better, they can tell it's better too.
This seems to be new.
It's not that somebody says, well, your blood pressure is much better today, but they can't tell how their blood pressure is. This team of the patient and the doctor is really fascinating. But I'm not unaware of the fact that some people think, well, is that you make more money in dermatology than you do in primary care, for instance. But they don't talk to me about making money or controlling their schedule because they know that I won't think that's such a laudable interest.
But for aspiring dermatologists, money, prestige, and lifestyle factors don't hurt.
Definitely how family-friendly a field is was clearly very important to me. And I knew dermatology was very family-friendly and that people won't feel like you're a burden for being pregnant or having kids during their residency, which happens in other fields and is extremely unfortunate because clearly our male counterparts can have as many kids as they want. I do think there's a generational difference in how doctors see their lives. Now that there's more women in the field, you kind of have to think about other things. You can't be in the hospital 24/7. You can't be there until the middle of the night every single night. That can't be your life if you have a family.
Singh gave birth to her second daughter in early January, right in the middle of interview season for residency programs. And as a working mother with 2 young children at home, Singh understands that there has to be a balance of her love of medicine with her desire for a family.
Neurosurgery, for one, is a field where they are known to not be very conducive to women who have kids. And if there's something I would wanted to do, I still wouldn't do it because I have to think about the sacrifices of my outside life. I wouldn't go into neurosurgery just for that specific reason.
Complicating things further, Singh's husband, Thomas Hawker, is also in his final year at Harvard Med School, hoping to become a dermatology resident in the same program or in the same city.
I was kind of like, oh my gosh, not only do I want to do this, and it's extremely competitive, but I'm trying to do this along with my husband.
And saddled with more than $300,000 in education loans, an additional $20,000 debt to interview for residency programs, Singh and her husband are looking forward to a medical career where they can potentially earn between $200,000 and $500,000.
So basically, we're broke as a joke, and all our credit cards are maxed out. And like I said, it's a sacrifice. We just did it because we made the choice. I wanted to go into dermatology. He wanted to go into dermatology. We said we wanted to do it, and so we did it.
On Thursday, March 20th, Singh and her husband will find out which dermatology program they'll get into.